In this video, we will talk about the glucose transport curve or glucose filtration curve and transport maximum. So we know that the glucose normal glucose level is in blood is about 150 milligram per deciliter, and the glucose molecule is fully filtered by the glomerular filtration or glomerular capillaries. So 100% glucose molecule will filtered in the glomerular filtrate, and then 100% glucose molecule will absorb by the uh, PCT in normal condition. Uh, so uh, when a glucose molecule is in normal level in blood or in plasma, then it fully absorbed by the PCT and not present in our urine. So what happened? A glucose molecule is about 250 milligram per deciliter. See here, uh, glucose plasma concentration is as increase. Then first see, I want to draw here the line of the filtered load of glucose. We know 100% of the glucose will filtered. So as plasma concentration is increase, as filtered load of glucose increase. See here, as plasma concentration increase so much, as the filtered load of the glucose will increase. See here, this is 250. But when we talk about the glucose reabsorption by the PCT, so up to 250, the 100% of glucose reabsorption occur by the PCT. So what amount of the glucose filtered, they all absorbed by the PCT. But after 250 milligram per deciliter, what's happened? That there is capacity of the glucose absorption in PCT. It means it is depend on the sodium potassium transporter, sodium glucose transporter present in the PCT. So actually, some nephron have low capacity or they have low PCT. So after 250 milligram per deciliter, they become fully saturated and not work. So the more absorption of the more plasma concentration of glucose will not affect these neurons, so no more absorption occur by these neurons, uh, these nephrons. So these nephrons not more absorbed after 250 milligram per deciliter. So when plasma concentration is increased to 50 gram, then slightly till curve present up to 350 gram, slightly till curve. And after 350 milligram per deciliter, all the nephron become fully saturated and no more absorption of glucose will present. So this after 250 some nephron will full, and after 350 all nephron will full and no more glucose absorption occur. So this is the filtration curve, and this is the absorption curve. Filtration is fully proportional, and however the glucose come, they all filtered, but absorption is limited. Up to 250 all the glucose 100% glucose absorbed, but from 250 to 350 some glucose molecule will present in urine. uh, but after 350 the more glucose molecule is present in plasma, in urine. So let's see how you urine glucose concentration in urine. After 350 slightly glucose present in uh, urine, and up to 350 slightly glucose present, but after 350 glucose concentration is directly proportional to the plasma concentration of urine, because after 350 no more absorption occur by the PCT. So this is the urine glucose present in urine. So this is glucose present in urine And now I want to explain some terminology. Glucose threshold or glucose renal threshold. What is glucose renal threshold? When glucose first time appear in the urine. See here, after 250 milligram per deciliter, glucose first time present in urine, and it is called the glucose renal threshold. And when the glucose absorption is no more occur, then this is called the glucose T max. And supply phase is formed when there's some after between 250 to 350, when some nephron is absorbing glucose and some is not absorbing more glucose. So this is supply phase will be formed. Supply phase will also form in the uh, uh, glucose present in urine. So this is the glucose curve. And glucourea. When glucose is present in urine, then it is called glucourea. Glucourea caused by three reasons. Number one, it can be pathological, it can be physiological, and it can be congenital. What is pathological condition? In some pathological condition, the plasma concentration of glucose will increase more. So like diabetes, mellitus, and other cases, when plasma concentration is become more than 250 to 350, glucose will present in urine and cause the glucourea. And the second condition is physiological. What is physiological condition? The physiological condition is that the in pregnancy, uh, because in pregnancy the GFR will increase. So when GFR will increase, then the team they reach very less time to the T max. So glucose present in urine, and it is also called the glucourea, and it is physiological condition because it happens in pregnancy. And number the third is congenital. Congenital, it is very less population occur. About 1 to 2% of people suffer from this disease because the glucose transport Tmax, their Tmax is very less. Suppose Tmax is in normal condition T50, but in congenital case Tmax is about 250. So Tmax is very low. So they will produce more urine in the they will produce more glucose in urine. uh, so this is also called the glucourea, but this is a congenital case. So these are the glucose transport curve and Tmax. What is Tmax? After that there is no glucose, more glucose absorption in the PCT. And what is a renal threshold? When first time glucose present in urine, that is called the renal threshold. Okay, thank you.